Welcome back, class. I am Dr. Caban, and this video presentation is on Chapter 19. This is Part 2 of Chapter 19, Assisting with Hygiene, Personal Care, Skin Care, and the Prevention of Pressure Injuries. This is Lesson 19.2, Hygiene and Personal Care. Upon previewing my presentation, as well as reading Chapter 19 in its entirety, you'll gain the following knowledge. You'll be able to discuss risk factors for impaired skin integrity, discuss the purpose of bathing, and describe how hygienic care for the younger and the older patients differ. You'll bring the following knowledge to the clinical practice setting. You'll be able to perform a complete bed bath and back rub, provide oral care for an unconscious patient, prepare to provide personal care for a patient including nail care, mouth care, perineal care, and shaving. You'll be able to assist a patient with the care of contact lenses as well as instruct a patient in ways to prevent buildup of cerumen in the ears. The data you've collected during your assessment will give you the information you need to plan your patient's hygiene care. Remember to include the patient's ability to perform the hygiene task and any personal preference or habits your patient may have. Remember that efforts should be made to help the patient maintain body image. That means protecting their privacy. Nursing goals for hygiene can include the following. The patient's skin integrity may be maintained. The patient's hair is cleaned and neatly styled each day. The patient's mouth is intact and free from odor. These are examples of nursing diagnosis in consideration for your patient's hygiene care. You've assessed your patient's hygiene needs. You've formulated a nursing diagnosis or nursing diagnoses based on your findings. You've planned the care for hygiene. Now you are ready to implement the care. So let's discuss implementation of bathing. There are 4 purposes as to why we provide bathing to our patients. Number 1 is to cleanse the skin. It also promotes comfort. It stimulates circulation as well as remove waste products. When bathing your patient, the water should be warm but not too hot so that it does not burn your patient's skin. The bathing may be needed to be given complete or partial depending on your patient. Remember to provide your patient with comfort, safety, and privacy during the bathing. Cleansing baths are the most common types of baths we provide to our patients. It is generally provided in a bath, tub, or shower. The terminology therapeutic means having healing or medicinal qualities. Therapeutic baths are performed to achieve a desired effect. There are several types of therapeutic baths. For instance, a whirlpool bath. This is done in a bathtub or a special whirlpool tub that has a device that agitates the water. The heat of the water and the agitation gently massages the skin. Whirlpools are used to cleanse, stimulate peripheral circulation, and also to provide comfort. Another type of bath is known as the sitz bath. This type of bath is usually common and used for patients after vaginal birth deliveries or rectal surgery. Sitz baths promote healing and relieves pain and discomfort. There are also certain types of sponge baths. For instance, a cooling sponge bath are used to help bring down fevers. There are variations of bed bath as well. Some facilities offer to their residents or patients pre-moistened disposable cloths. The advantages here are that these cloths are moistened with a cleansing agent that does not need rinsing. They can be heated or used directly from the bag. And the bag contains many cloths, so a different cloth may be used for different body parts. A great disadvantage is that this type of system is quite costly. When bathing the older adult, consider why full baths are not needed every day. Well, the fact is older adults have decreased sweat and sebaceous gland activities. Therefore, a full bath is not required every day. But certainly consider personal preferences. Pre-warm the bath area and provide adequate draping. Use warm water, not hot water, and a minimal amount of mild soap. Ensure to rinse your patient thoroughly and pat dry the skin to minimize skin irritation. Also take special consideration to prevent slips and falls. When you're providing hygiene care to your patient, provide them also with a back massage. This is certainly an important part of hygiene care, and it involves the sense of touch. The benefits of massage include communicates caring, fosters trust in nursing-patient relationship, provides an opportunity to assess the skin on the patient's back, it stimulates circulation of blood to the area, and it also reduces tension and promotes relaxation. Remember, when you're providing perineal care to your patient, this may cause some form of embarrassment, not only to the patient but to you as well. Always ensure adequate privacy. Properly drape your patient. This helps to promote comfort with the procedure. Explain the procedure to reassure patient and gain cooperation in the task. Maintain matter-of-fact attitude and be objective. Avoid any sexual suggestive conversation or actions. A professional and dignified attitude can help reduce any embarrassment. Mouth care is included in providing hygiene care to your patients. So when providing mouth care to the conscious patient, remember to raise the head of the bed 45 to 90 degrees. Place a towel under the chin, moisten the toothbrush, apply toothpaste, brush the teeth from the gum line to the edge of the teeth, have the patient rinse and spit, and also provide the patient with a cloth so that they can wipe their mouth. Now providing mouth care to the unconscious patient. Provide full mouth care at least once every 8 hours, but if the patient mouth breathes, the care should be done every 4 hours. Remove any dry secretions because they can cause halitosis, which means bad breath, and may obstruct airflow. Moisten a swab and pass it in the mouth at least every 2 hours, or as needed to maintain integrity of the oral cavity. If your patient has dentures, you will provide them with denture care. Recall the skill set that we went over during lab session. Skill 19.3, providing denture care, can be found in your textbook on page 312. Remember that denture cares can be important in preventing gum irritation and prevents infection. A patient may use an adhesive for better fit if they need it. Also, care should be provided in the morning as well as at bedtime. Be sure to provide your patient with hair care on a regular basis. This will help prevent entanglement or the hair becoming matted. Use a clean brush or comb to brush your patient's hair. Start from the scalp towards the hair ends to decrease pulling. If you want to cut your patient's hair, a written informed consent is required. A great benefit to shampooing your patient is that it helps remove dirt, soil, blood, or solutions from the hair. It helps stimulate circulation of the scalp and eases bruising and combing. This may be done in the shower, bath, sink, or bed. Shaving your patient is the act of removing hair from the surface of the skin. This can be from the facial hair, legs, or axillary. Be gentle. Use short strokes with the safety razor. When you are providing bath care to your patients, this is the perfect time for you to provide them with nail care. You want to ensure that you trim the nails and cleanse under the nails using an orange wood stick. You also want to provide cuticle care. Be sure to push the cuticles back gently. When you clip the nails, you should cut the toenails straight across. Patients who have diabetes or who have impaired circulatory disease require a physician's order for you to cut their toenails. Ask yourself this question: why should toenails be cut straight across? Well, when you use clippers to cut the toenails straight across, this prevents them from growing into the skin along the sides. When you're providing your patient with eye care, assess your patient for drainage, crusting, or redness. Ensure to report any abnormal findings to the provider. If they have glasses, you want to ensure that you clean them with warm water and a soft cloth. Be careful when you're removing the contacts and cleansing them. If your patient has an artificial eye, the eye needs to be removed daily for cleansing. You remove the eye by pulling downward on the lower eyelid and just apply just a little bit of pressure below the eye. Have your other hand underneath in a cupped form to catch the eye, just in case it falls out of socket. Cleanse the eye with normal saline. To replace the eye, pull down on the lower lid and lift the upper lid. Place the eye in the socket and be sure the eyelid fits smoothly over the eye. When you're providing your patient with ear care, you want to consider the care for their hearing aids. Clean the earpiece with soap and water daily to prevent the buildup of wax or debris. Do not submerge the hearing aid in water. If the hearing aid is not working, check to make sure the unit is on, that the battery is installed correctly, and that there is no visible cracks or breaks in the plastic housing or tubing. Remember that the final stage of the nursing process is evaluation. So you've assessed your patient, you've formulated your diagnosis, you've planned the care, you've implemented care based on their hygiene needs. Now you want to evaluate the outcomes. The evaluation is done to determine whether or not the expected outcomes have been met. Evaluation statements indicating the expected outcomes for hygiene have been met include the following. Patient has no evidence of redness, irritation, or breaks in the skin integrity. The skin integrity is maintained. Hair is clean and neatly styled each day per patient's preference. And the mucous membranes are pink and moist without signs or symptoms of irritation or odor. This concludes my presentation on the second half of Chapter 19. Let's start reviewing some questions together. So question number 3. Which of the following is not one of the basic purposes of bathing your patient? Is it A, cleansing the body? B, promotes comfort? C, stimulates conversation, or is it D, removes waste products? Consider your response for this question. The correct response here is C. The basic purposes for bathing are that this is to cleanse your patient's body, it promotes comfort, and it does help remove waste products, and also promotes stimulation of circulation to all of the body. Stimulation of conversation is not the purpose for bathing. Let's look at question number 4 now. Which of the following is true regarding mouth care? Is it A, mouth care creates halitosis and dental caries? Is it B, an unconscious patient should be provided mouth care at least every 24 hours? Is it C, when assisting a conscious patient with mouth care, you should raise the head of the bed 15 to 30 degrees? Or is it D, dentures should be kept in a labeled denture container with saline or water when the patient's not using the dentures? Consider your response for this question. The correct response here is D. Dentures should be kept in a labeled denture container when they're not in the patient's mouth. Here's our final question, question number 5. Gary is a nurse working in an acute care facility. His patient is a 20-year-old male who was in an automobile accident. He has blood and glass fragments in his hair, a fractured femur, a mild concussion, and is negative for any other health problems. Which of the following is not an appropriate nursing intervention? Is it A, shampooing the patient's hair and cutting any glass fragments out of the patient's hair? Is it B, washing his feet and trimming his toenails? Is it C, asking the patient if he wants you to call any family or friends? Or is it D, allowing the patient time to rest? Again, which of the following is not an appropriate nursing intervention? The response here should be A. Shampooing the patient's hair and cutting any glass fragments out of his head and hair should not be done. You may not cut a patient's hair without informed consent unless it is an emergency. This concludes my presentation on Chapter 19, Assisting with Hygiene, Personal Care, Skin Care, and the Prevention of Pressure Injuries. Remember to review Presentation Part 1, as I brought this information to you into 2 video parts. Also, read Chapter 19 in its entirety. Thank you.